Just another frequent flyer wasting our time. That's what ER nurse Emma Whitmore muttered as she rushed past the elderly homeless man sitting in the county general waiting room. She barely glanced at him, her mind already on patients she deemed more deserving of care. But when she finally scanned his hospital wristband and saw the code Level 7 Clearance, MACV-SOG, her world stopped. What those letters meant would bring a decorated doctor to his knees in respect and expose just how badly this young nurse had misjudged a man who'd sacrificed everything for his country. If you believe every person deserves dignity regardless of appearance, type respect right now. Thomas Reaper McAllister had been sitting in the waiting room of County General Hospital for 3 hours, his weathered frame folded into one of the plastic chairs that lined the sterile, white walls. At 81 years old, Thomas looked every bit the homeless veteran he'd become. Tattered military jacket that no longer fit his thinning frame. Worn boots held together with duct tape, a gray beard that hadn't been trimmed in months, and the unmistakable smell of someone who slept on streets and under bridges. His belongings sat in a trash bag at his feet. A sleeping bag, some canned food, and a small box he never let out of his sight. On his right wrist was a faded hospital wristband from a VA facility 3 states away, the plastic yellowed with age, but still intact. Thomas sat with the stillness of someone accustomed to waiting, his eyes distant, focused on something no one else could see. The other patients gave him a wide berth, some wrinkling their noses, others averting their eyes entirely. To them, he was invisible. Just another homeless person clogging up the emergency room. Emma Whitmore swept through the waiting room with the brisk efficiency of someone who'd learned to triage, not just by medical need, but by social worth. At 26, she'd been an ER nurse for 4 years, long enough to develop the cynicism that came with the job, but not long enough to have wisdom temper it. She was good at her work, fast, competent, technically skilled, but she'd also developed a ranking system in her mind about which patients deserved immediate attention and which could wait. Homeless individuals, frequent flyers as the staff called them, always went to the bottom of her list. She'd convinced herself it was pragmatic. They often had complex social issues that weren't true emergencies. They'd be back next week anyway. And her time was better spent on real patients. As she moved through the waiting room with her tablet, checking on various patients, her eyes slid over Thomas as if he were part of the furniture. Her co-worker, Jake, a newer nurse, glanced at the elderly man and then at Emma. "Should we check on him? He's been here a while." Emma barely looked up from her screen. "Frequent flyer. Probably just wants a warm place to sleep and a sandwich. He'll wait." The ER was having a typically chaotic Monday. A car accident had brought in 3 patients simultaneously. A child with a severe asthma attack needed immediate attention, and the waiting room was packed with people nursing various ailments from flu to chest pain. Emma moved through it all with practiced efficiency, her ponytail swinging as she hustled between triage, treatment rooms, and the nurses' station. She was in the middle of inserting an IV when Jake approached her again. "Emma, that homeless guy? He's holding his side and looks pretty pale. I think we should—" Emma cut him off without looking away from her patient's arm. "Jake, look around. We have actual emergencies. He's stable, he's conscious, he can wait. That's how triage works. You'll learn." Jake hesitated but backed off, though his expression showed doubt. Emma had seniority, and he'd been trained not to question experienced nurses. But something about the old man's stillness bothered him. It wasn't the agitation of someone seeking attention. It was the quiet endurance of someone who'd learned not to complain. 4 hours in, Thomas's breathing had become more labored. The pain in his side that had brought him in, the reason he'd walked 6 miles from his encampment under the highway overpass, was getting worse. He suspected internal bleeding, maybe from a fall he'd taken a week ago when some teenagers thought it would be funny to knock over a sleeping homeless veteran. He hadn't made a sound during the beating, old training kicking in, staying silent even as their boots connected with his ribs and abdomen. He'd crawled away after they left, patched himself up as best he could, and tried to push through, but the pain had intensified, and he'd recognized the signs of something seriously wrong. Hence the long walk to County General, the place closest to his current territory. He'd checked himself in at the registration desk, given his information to a board clerk, and taken his seat. Now, as the afternoon stretched into evening, Thomas felt himself fading. The edges of his vision darkened occasionally, and he knew that wasn't good, but he also knew how to wait. He'd waited in jungles for days without moving, waited in the darkness for targets who might never appear, waited for extractions that sometimes didn't come. He could wait a little longer. Emma grabbed a protein bar from the nurse's station and was scrolling through her phone, enjoying a rare 5-minute break when the hospital's automatic doors opened and Dr. James Hassan walked in. Hassan was County General's Chief of Emergency Medicine, a man whose reputation was legendary. At 53, he'd served as a combat surgeon in Iraq and Afghanistan before transitioning to civilian medicine. He commanded respect not through intimidation but through sheer competence and a quiet dignity that reminded people of a different era. He wasn't scheduled to be in today, but a call from administration had brought him back. As he passed through the waiting room on his way to his office, his eyes swept the space with the practiced assessment of someone trained to spot critical details. His gaze landed on Thomas and stopped. Hassan's expression changed, something flickering across his face, recognition, surprise, perhaps reverence. He altered his path and walked directly toward the elderly homeless man. Emma, watching from the nurse's station, felt a flicker of curiosity. Why was Dr. Hassan, of all people, approaching the frequent flyer? Hassan stopped in front of Thomas, who looked up slowly, his eyes taking a moment to focus. "Sir," Hassan said quietly, "may I see your wristband?" It wasn't a demand, but a request, delivered with unusual gentleness. Thomas extended his right arm, the motion obviously painful. Hassan leaned down, pulling reading glasses from his pocket, and examined the faded wristband carefully. His fingers traced the worn letters and numbers. Emma watched from a distance as Hassan's posture straightened, then as he did something she'd never seen him do in 4 years of working together. He took a step back and saluted, crisply, formally, holding the salute until Thomas, with obvious effort and trembling hands, returned it weakly. The waiting room went quiet. Other patients watched. Jake's mouth fell open. Emma felt ice slide down her spine. Hassan turned toward the nurse's station, his expression unreadable but his voice carrying clear authority. "Nurse Whitmore, come here, please." Emma's legs felt wooden as she walked across the waiting room. She'd never heard that particular tone from Dr. Hassan before. Not angry, but something far more serious. When she reached him, he spoke quietly but with an intensity that made her understand immediately that something significant was happening. "This patient's wristband, have you scanned it?" Emma's mouth went dry. "No, sir, we've been busy, and I was going to get to him after—" Hassan held up a hand, cutting off her excuse. "Scan it, now." Emma pulled her scanner from her pocket, her hands shaking slightly, and held it over Thomas's wristband. Her tablet beeped, and text began loading on the screen. At first, it was standard patient information, name, date of birth, blood type. Then, additional screens loaded, things she'd never seen before in a patient file. Red text appeared. Level 7 clearance, MACV-SOG. Below that, security clearance required for full medical history. And below that, alert, patient may have service-connected injuries classified under Title 50. Emma's eyes widened as she scrolled. 3 purple hearts, 2 silver stars, a navy cross, commendations that went on for pages, and everywhere the acronym MACV-SOG. "Do you know what MACV-SOG means, Nurse Whitmore?" Dr. Hassan's voice was quiet, but everyone in the immediate area had gone silent, straining to hear. Emma shook her head, unable to form words. Hassan continued, his eyes never leaving hers. Military Assistance Command, Vietnam, Studies, and Observations Group. It was the most classified special operations unit in the Vietnam War. They ran cross-border operations into Laos and Cambodia that officially never happened. Reconnaissance missions deep behind enemy lines, prisoner rescues, sabotage operations. The men who served in SOG had the most dangerous job in the entire war. Less than 5% of all Vietnam veterans served in SOG, and their casualty rates were astronomical. This man, he gestured to Thomas, was a team leader. He ran over 40 missions into territory where capture meant torture and execution. He brought his men home when others said it was impossible. Emma felt like the floor was tilting beneath her. Hassan wasn't finished. That wristband is from a VA facility that specializes in treating SOG veterans. Level 7 clearance means his service record is still partially classified 50 years later. The operations he ran, the things he did, saved countless American and Allied lives. And you made him wait for 5 hours. The words hit Emma like physical blows. She looked at Thomas, really looked at him for the first time, and saw past the tattered clothes and weathered face. She saw the scars visible on his hands and neck. She saw the way he held himself despite obvious pain, that military bearing that never completely disappeared even after decades. She saw the purple discoloration around his left eye, that she'd dismissed as the result of a drunken fall, but now recognized as signs of violence. "Sir, her voice cracked. "I didn't know. I thought he was just—" She couldn't finish the sentence. "Just what? Just another homeless person? Just someone not worth her time?" The shame crashed over her in waves. Hassan's voice softened slightly but remained firm. "That's the point, Nurse Whitmore. You didn't know. You made assumptions based on appearance. You triaged based on social status rather than medical need. And now a man who served this country in ways most people can't imagine has been sitting here with what I suspect, given his guarded posture, is internal bleeding." He turned to Jake. "Get a gurney. Treatment room 3. I want a full trauma workup immediately." As Jake rushed off, Hassan knelt beside Thomas. "Sir, we're going to take care of you now. I apologize for the delay. You should have been seen immediately." Thomas's voice, when he spoke, was rough but steady despite his pain. "Not their fault, Doc. I know what I look like. People see the outside, not what's underneath. Can't blame them for that." But Hassan shook his head. "With respect, sir, yes, I can. These young people need to learn that everyone who comes through those doors deserves dignity and proper care, regardless of how they look or what their circumstances are." Jake returned with a wheelchair, and Hassan personally helped Thomas into it, treating him with a gentleness that contrasted sharply with Emma's earlier dismissal. As they moved toward the treatment area, Emma followed, her tablet clutched in trembling hands, the weight of her failure crushing down on her. In treatment room 3, once Thomas was transferred to the bed and Jake began taking vitals, Hassan pulled Emma aside. "His blood pressure is dropping. Heart rate is elevated. He likely has significant internal injuries that have been worsening all day. Every hour he waited increased the risk of catastrophic complications. Do you understand what I'm saying?" Emma nodded, tears now streaming down her face. "He could have died in our waiting room." Hassan's expression was grave. "Yes. And it would have been because we failed him. Not because we lacked resources or knowledge, but because we made judgments about his worth as a human being based on his appearance." He paused, letting that sink in. Thomas Reaper McAllister earned his call sign by being death incarnate to the enemies of this nation. He infiltrated positions that were supposed to be impenetrable. He survived in jungle environments that killed stronger men. He pulled wounded teammates through enemy fire when evacuation was impossible. The military commanders who sent him on those missions knew they were asking him to do things that would break most people, and he did them anyway. Every single time. Hassan's voice dropped even lower. He came home to a country that didn't understand what he'd done or appreciate what he'd sacrificed. Like many SOG veterans, he struggled with things civilians couldn't comprehend. He's been homeless on and off for 20 years, and today, when he finally asked for help, we made him wait because we decided he wasn't important enough. An ultrasound confirmed Hassan's suspicions. Thomas had a slow bleed from a lacerated spleen, likely from blunt force trauma. He needed surgery, and he needed it soon. As the surgical team was called, Emma found herself at Thomas's bedside. "Sir," she said, her voice barely above a whisper, "I'm so sorry. There's no excuse for how I treated you. I made assumptions I had no right to make. You deserved better. So much better." Thomas looked at her with eyes that had seen too much, eyes that held a strange mixture of understanding and sadness. "Miss, I stopped expecting better treatment a long time ago. The world forgot about people like me decades ago. We did terrible things in terrible places so people back home could sleep safely and never have to know those places existed. That was the deal. We knew it when we signed up." His breathing was labored, each word an effort. "But you need to remember something. Every person who comes through those doors has a story. You can't see it by looking at them. The businessman in the suit might be falling apart inside. The soccer mom might be hiding bruises from an abusive husband. And the homeless veteran might have sacrificed more for this country than anyone else in the building. Don't ever forget that." The surgery took 4 hours. Dr. Hassan personally supervised, and Emma stayed late even though her shift had ended, unable to leave until she knew Thomas would survive. When he finally emerged from recovery, stable but critical, Emma was there. Over the following days, as Thomas recovered in the ICU, his story spread through the hospital. Staff members who'd walked past him, who'd delayed his care, who'd made assumptions about the homeless man in the waiting room, came to understand what they'd done. The hospital administrator visited personally to apologize. A social worker began working on securing Thomas proper VA benefits and housing. Other veterans came to visit, having heard that a SOG legend was in the building. And Emma showed up every day. Even on her days off, she sat with Thomas, listened to the stories he was willing to share, and learned about the brother he'd lost in Vietnam, the wife who'd left him when his nightmares became too much, the children who didn't understand why Daddy couldn't be normal, and the decades of struggling with demons that had no name in the 1970s. Dr. Hassan used the incident as a teaching moment for the entire emergency department. During the next staff meeting, he didn't name Emma specifically, but he told Thomas's story. He explained that County General served everyone, that every patient deserved respect, and that assumptions based on appearance were not just unprofessional but potentially deadly. "We took an oath," he reminded them. "First, do no harm. But before we can treat someone, we have to see them, really see them. Not their clothes, not their social status, not our assumptions about who deserves care. We see the human being in front of us who needs help. That's our job. That's our calling." The staff listened in silence, many fighting back tears, all understanding that something fundamental had shifted in their workplace culture. Emma implemented changes in the triage system to prevent similar situations. She started a program to train new nurses on unconscious bias, and she volunteered to work with the hospital's new homeless outreach initiative, determined to ensure no veteran would ever wait like Thomas had again. 3 weeks after his surgery, Thomas was discharged not to the streets but to a studio apartment secured through VA housing assistance. The hospital had connected him with proper medical care, mental health services, and a veterans support group. Emma helped him hour in, bringing groceries and basic furniture donated by staff members. As they sat in his new living room, small but clean and safe, Thomas looked around with something approaching peace. "Never thought I'd have a place like this again," he said quietly. Emma squeezed his hand. "You always deserved it. I'm just sorry it took so long, and I'm sorry I almost cost you even more." Thomas shook his head. "You learned. That's what matters. You'll be a better nurse because of this. You'll see people instead of problems. That's worth something. Emma nodded, unable to speak around the lump in her throat. She thought about the person she'd been just weeks ago, rushing past people she'd deemed unworthy of her time, and felt ashamed of that version of herself. But she also felt grateful for the lesson, however brutal it had been. Dr. Hassan continued to check on Thomas regularly, the two developing an unexpected friendship bound by mutual respect for service and sacrifice. Hassan learned that Thomas had volunteered at a shelter before becoming homeless himself, helping other veterans navigate the VA system despite his own struggles. Even at his lowest, Thomas had tried to lift others up. It was a humbling reminder that heroism wasn't confined to battlefields or grand gestures, but existed in quiet acts of service that no one noticed or celebrated. The hospital staff adopted Thomas as one of their own, inviting him to the Veterans Recognition Ceremony they held each year. When Thomas walked into the auditorium wearing the donated suit they'd given him, his posture straight despite his age, staff members rose to their feet in spontaneous applause. Emma stood in the front row, tears streaming down her face, finally understanding the magnitude of what she'd almost lost through her own prejudice and impatience. Subscribe to my channel if you believe that dignity and respect should be given to every person, regardless of their circumstances or appearance. Share this story if you think healthcare workers and all of us need reminders that we can't judge a person's worth by looking at them. The next time you see someone who appears homeless, remember that they might be a hero who sacrificed everything for your freedom. They might be fighting battles you can't see, carrying burdens you can't imagine. Type honor. If this story moved you, and remember Thomas Reaper McAllister, who survived 40 classified missions behind enemy lines only to be made invisible by the country he'd served. True heroes don't always wear medals. Sometimes they wear tattered coats and sit quietly in waiting rooms, hoping someone will see past the surface to the person underneath. Don't be the nurse who rushes past. Be the person who stops and looks and sees.